field. Uh, for your knowledge or information, I just wanted to tell you that uh, the study of CHO was started by me in Jharkhand with 12 people only, the first batch. Then with eSanjeevani, I am associated from the day of inauguration because I was the only doctor sitting in the hub on that day, inaugural day. So you can well understand my own commitment. And since then, I had been training all CHOs, medical officers across three states, Jharkhand, Odisha, and Karnataka. Now, Karnataka, we have another trainer, Dr. Nilofar, for CHOs. Uh, yes, you people are doing great job as far as teleconsultation is concerned, eSanjeevani is concerned. You are doing about more than 4 lakhs of uh, teleconsultation per month. Now, I am here to tell you a brief about the basics of telemedicine operation, how it operates, how it works, eSanjeevani. You may all be knowing about it, but I just wanted to refresh it to improve your idea about eSanjeevani platform. Some of you may be new, you may not have done teleconsultations on it, but I believe most of you have started doing it because the number itself, number of 4 lakhs plus consultation per month, itself says that you people are doing it greatly. That's great, right? So thank you all very much for doing it. And whoever is not doing, my request would be to give 1 hour, 1.5 hour every day at least for the poor people who live in rural areas, who do not have much money, who do not have good literacy to understand the consequences of the disease. So if you are you address to a rural person while teleconsultation through teleconsultation, audio video consultation, I think it is a great thing for a rural person to talk to a doctor about their disease. It will be a dream for them, right? So you can always do that, taking out 1.5 hour time every day at least for teleconsultations, and this is not a big deal. Okay, so I'll tell you in brief. There are certain things which I wanted to tell you in the latter part of my this training. I'll be explaining you the follow-up care of NCD, what you should do, what you should not do, and of course, I'll give you a brief idea of few case scenarios, and I would request everybody to participate in that case scenario explanation, interact with me so that you also understand it in a better way. And I have an experience of about 44 long years of medicine. So we can discuss certain things. You can ask me about this any point of time. Okay. So this is eSanjeevani is a hub and spoke model. Now, what is a hub? Hub is a place where doctor sits. It's imaginary uh, area. The moment you log in, you enter into hub. The moment you log in on your mobile or laptop or the desktop, you enter into hub. Now you will be getting calls from Health and Wellness Center CHO. CHO generates the call for their patient, rural patients, and you will go through all the clinical data on eSanjeevani platform, and accordingly, as per your discussion, your knowledge, your experience, you can uh, give e-prescription. You can give a diagnosis. I'll tell you what important things you must do to make it more successful, more fruitful. So in the center, you see there is a cycle wheel type of picture. These are spokes. Spokes means health and wellness center. And that's why this platform is called eSanjeevani SWC. And all SWCs are spoke. And you are sitting here in the red circle, that is hub, like a doctor sitting on the right in the right photograph, sitting in the hub. It is a physical hub. There are some places, some district where we have physical hub and doctor come sits there as per their roster. But basically, the moment you log in into your profile, you are into the hub and you can take the call. So you are seen available to all CHUs on their um, platform, right? So they will select you and give a call to you about their patient. It is as easy as it's a very simple system. On the left is the CHO, so they can do it. So this hub and spoke model has three labels. Now there is absolutely one spoke model, a spoke label, and these labels are defined. A spoke is the community health officers sitting in health wellness centers or Ayushman Arogya Mandirs or the old sub health centers already branded and updated with upgraded with all necessary infrastructures. Lots of things are happening there. So CHO generates the call to you. You are sitting in this Spokecom hub level 2. Okay. So all medical officers of subdivisional hospitals, CSC, PSC, urban CSC, primary health center, Nama clinic, Asmati clinic, so all doctors who are registered sits into level 2. Okay. And you will be getting calls from level 3, meaning thereby the CHOs will generate the call, will talk to you, will send you the details of the patient, and accordingly, you can have an audio video chat and you can give the e-prescription as per your discretion, right? Now, just in case you are sitting in your OPD and you need some idea, some opinion from a specialist, so all specialists sit in level 1. All medical college specialists, all district hospital specialists, so they are sitting into level 1. So if you are working you are doing an OPD, if you have some problem, some challenge, you can always call level 1 specialist and take their opinion. They have a roster of few hours on certain fixed dates, different specialization on different days. So accordingly, you can select. You must have that. You must have access to that, and accordingly, you can call the specialist. You can take their opinion. You can take their prescription, and then you can prescribe it to your patients. Right. So this is all three levels. CHO to doctor, meaning thereby you, and doctor to doctor. So level 3 to level 2 and level 2 to level 1. This is the standard labels of eSanjeevani platform. Now, what are the roles and responsibility? I'll not go into details of it. A doctor has a fixed role. First level consultation you have to facilitate. Then he prescribe the medicine as per the history and the findings or clinical findings, whatever you feel. So you have to give a prescription of medication, and then uh, you can advise health counseling or any what do you call any other advice which you feel is essential or necessary for the patient. You can give it to them through that eSanjeevani platform of doctors platform, right? Okay, so uh, in this images can be loaded. So CHO can upload the image in eSanjeevani SWC. It has the benefit that CHO can upload old images, old reports, support the X-ray, the ultrasound, the blood reports, so that it will be easier for you to see and go through it and admit your diagnosis accordingly, or any previous treatment chart. You can go through that, right? If there it is, the CHO has not uploaded, so if you feel that patient was treated earlier So you can ask the CHO to upload those previous uh, documents so that you can see it and make your own opinion, right? And then give your prescription, right? Okay. Now, this is the teleconsultation is like OPD. You work in OPD. We all work. Now, we see two types of cases, emergency and non-emergency cases. So, whatever emergency cases comes to you, that becomes emergency consultation, and rest all are non-emergency consultation. Now, emergency consultation should be limited to first aid and life-saving measures. We have to consider to increase that golden hour by helping the CHO to provide first aid and life-saving measure so that the patient, that golden hour is maintained or increased by your support, right? So I think it's clear. We need not become dynamic in treating any emergency cases through teleconsultation. Get this point. We should not be very dynamic about it. We should be proactive in providing first aid and life saving measures through CHO as per our experience, our knowledge, and everything. But we cannot treat the patient fully. So you can advise the CHO to provide the patient with first aid or life saving measures, anything, and refer the case for in person treatment at the nearest CHC or district hospital or wherever you feel sorry, that this type of disease should be treated at such and such particular institution. So you can advise the CHO to send the case over there. Okay, so emergency consultation should be limited to this part only. Now, for example, a case of acute breathlessness. Now we know history of asthma. Patient comes with acute breathlessness. Now you can advise the CHO to give a bronchodilator, to add oxygen, to give IV fluid, add and refer it to. If need, a shot of steroid may help if you decide it. To increase that golden hour, by the time the patient reaches to an intuition, he should sustain, sustain with comfort, little comfortable. If we add bronchodilator, definitely the patient will be beneficial. If we ask the CPHO to nebulize the patient for a few minutes before sending, that will help the patient. If he gets some oxygen supplementation, that will be of great help. So, sort of that. We are not keeping the patient there and treating the patient there. We have to ask the CHO to refer the case to the nearest CSC or what do you call the district hospital, whichever is the nearest, where that patient can be treated. Right? So we need to be clear in our goal. Now, rest all are non-emergency consultation, and it is of two types. First consultation, any patient with one disease is coming and taking your consultation for the first time is first consultation. Okay, any subsequent consultation about the same disease, you call it follow-up consultation. Every day in OPD we are seeing the cases as a first consultation, then subsequent follow-ups. We are always doing that. So it is nothing new for you all. It's the same in teleconsultation. But there is a limitation in teleconsultation that it should be limited. The follow-up should be limited up to 6 months only. If the follow up increases the 6 months period, you have to do a first consultation mandatorily. That is important. You have to do it again, right? So, this is the difference than OPD. OPD, you can give subsequent consultation, no issue, but that is in person consultation. This is not in person. This is through teleconsultation, eSanjeevani platform. So you can do it up to 6 months, all the consultations, follow-up consultation, right? But after 6 months, you need to see the patient again, and that's mandatory. That's remember. Okay. So now I was talking about these two modes, CHO to doctor level 3 to level 2, and doctor to doctor means level 2 to level 1. I have already explained about it. Doctor to doctor and CHO to doctor, two levels. Now, in this, consent is mandatory and legal. CHOs are not taking any consent. Now, I am training, since I am training the CHOs of all the three states, I am telling them to get it documented. Because if tomorrow some medical legal thing happens, they, I mean, anything can happen up to that. So the higher authority will ask, have you taken the consent? That's the part of our medical practice. We all know about it. So the moment you contact the CHO, I mean, you get a call, you receive the call, ask first thing, have you taken the consent? You must ask all CHO because, as per my survey, CHOs are not taking consent, which is mandatory and which is legal in telemedicine. So just remember that and ask the first question, have you taken the consent? And then CHO will respond yes or no. If not, then ask them to take and then continue with your treatment part and examination part. Likewise, in doctor to doctor, again, you have to take the consent of the patient about whom you have to take any consultation from a specialist. So days are fixed. If you decide that an orthopedic is required, see in the roster which day, what time the orthopedic surgeons are sitting, and then call them and take the opinion. Now, CHOs can also call to specialists directly. This is the benefit at present. So many specialist cases are going to them directly from CHO, like old cases sort of thing, right? So consent should be explicit and clear. Okay. Now, what are the patient evaluation you do? It's like anything. You will take history, examination findings, examination by the CHO. You can't examine. The worst thing. You cannot examine. But you can observe how CHO is examining it. You can ask CHO to examine or palpate for liver or spleen. You can ask them to see any additional breath sound is there like rhonchi, wheeze or anything in the chest. So you can always ask them to furnish you with that information after their examination, and you can oversee it through video. We have each surgery, we have four windows, four different types of windows for video consultation. You can opt any one of them, whichever you feel is convenient for you to communicate with the patient and communicate with the CHO. You can opt that window, that type of window, and you can talk to the patient. You can ask the CHO to perform examination for on your behalf and feed you the result of the finding, right? So must do that. Now, for any physical examination, if physical examination, in your opinion, is essential, then do a video consultation, not an audio consultation. So always do video consultation if you feel that physical examination is required and see that it is properly examined, right? Because it is the examination by other people, CHO, community health officer, the health providers. So they may not be capable enough, may not be knowledgeable enough to perform the examination the way you want it. So you can always observe and guide them how to examine and what the result should be, right? If you have any doubt about the case, despite of your observation and everything, all case history and everything, if you feel that it's difficult to treat the patient through teleconsultation, then call the patient immediately for an in person consultation. Check it. Ask the CHO, send the case. It is not clear. I want to examine it. I examine the patient personally at my CSC or PSC or district hospital, wherever you are sitting. So you can always tell CHO, you can always ask the patient, you come to me. I will examine personally and then we will treat you. So that is a wise decision, and you have to take a call every time you see a patient, right? Now, e-prescription. You have to generate an e-prescription. Initially, I said. Now, what are those? What does it contain? Health education, like lifestyle modification. This education part to the patient. So, diet restriction, diet about diet, what to take more, what not to take, increasing lifestyle modification, increasing physical activity, 30 minutes a day, 5 days a week. So you can spell it to the patient. You must walk to an NCD case. Cessation of alcohol, smoking, or these sort of things you can always advise to the patient, right? You can talk to the patient directly and guide them, educate them. Uh, or you can ask CHO. If you don't have time, then ask CHO to tell the patient and educate the patient about what things you can always spell it out to the CHO, right? Counseling, as far as counseling is concerned, or any treatment thing is required, like phototherapy, use of hearing aid, or any specific dietary restrictions, whatever, you can advise on the eSanjeevani platform. So you can do that. Then the most important is your prescription of drugs. That is your discretion, your professional discretion. Sidewise, like in OPDs, you are prescribing with your discretion, with your knowledge, with your experience. You are selecting drugs, you are giving them to the patient, and of course, you are accountable for your OPD prescriptions. And likewise, it is in the telemedicine also. Whatever you decide to give to the patient for their benefit, it will be your discretion to select the medicine as per your knowledge, as per your experience, and you will be accountable for your prescription. It is like OPD. Okay. Then we have to go for a follow up. We must give a follow up date. In teleconsultation, what happens? The people take it very lightly. I told you they are less literate, so they don't understand. But it's a dream for them to talk to a doctor in person. They are unable to reach to you because they don't have money, they don't have means, they cannot travel that far where you are sitting. So that way, it is a boon for them, this teleconsultation. Uh, so you must give a follow up date because that will be in their mind. Otherwise, what happens sometimes, which I have noticed, that the patient, if not benefited with your medication for 2 days, they will rush to a quack. And that's the worst situation. I want you all to give a follow up date so that it is in the mind of the patient that doctor has called me. They have called me after 2 days to report if not benefited. So I will go to the doctor again rather than going to the quack. So it's a bonus point, right? So must put a date of follow up review after 2 days, 3 days, whatever period you decide. Then when to refer, you know better. Okay, for in person or for emergency consultation. When to refer, you are a better judge. You can decide any point of time and you can send the case to respective institution where you feel that that patient can be treated well, right? Or I told you earlier, if you have any doubt about your diagnosis, through teleconsultation, call the patient in person and then examine and then treat the patient. These are few list of drugs. List O is over the counter. This can be dispensed by CHOs directly without your prescription. But list A and list B drugs are the medicines which needs your prescription. Without your prescription, CHO cannot dispense this medicine. That is the biggest issue. So Antibiotics are there, antihypertensives, anti-diabetics, first-line drugs. Okay, metformin, enalapril, latenolol, sort of that. Then all types of antibiotics. They need your prescription. Okay, these are list A drugs. Any add-on drug is list B drug. So, say thiazides. Thiazide we add to as anti-hypertension. Or sitagliptin, vildagliptin for diabetes. So these are add-on drugs. We add on with metformin frequently. So these B drugs, they also need your prescription. Okay. So these are list of drugs, the types of drug which needs your prescription are list A and list B, not the list O. List O, CHO can give directly to the patient. Okay. And these are, addition to list A, these are antipsychotic medicines, antipsychotropic. Right. Now, these drugs you cannot prescribe. Get this, huh? These can be prescribed only by psychiatrist. Okay? Like phenobarbital, clobazam, clonazepam. These are very commonly used antipsychotics. But you cannot prescribe these drugs, antipsychotic. Remember this. You should not, and you will not. Only psychiatrist, you refer the case to a psychiatrist. If you feel that the patient has some mental issue, some psychological issue, you can always refer the case for a specialist consultation because in most of the states there is a psychiatric hub. So patient can connect over there with a psychiatrist and then they can prescribe those medications. But you should not. You will not. Right? So thank you for that. Now this is a standard prescription as you see. In this, you see, there is a diagnosis column. We all know we have to diagnose a case. Every time we see a case, we must give a diagnosis, and that is readily available in your platform, eSanjeevani platform, in your part. You drop down, you select any drop down, you select the disease and select as a provisional diagnosis or a final diagnosis. You can make your diagnosis, but must make a diagnosis with be it provisional or be it final, right? Then you prescribe you select your medications. It's a very easy way to select. I think Harish will tell you about that. And then the review after 3 days. That's important thing I want to mention that this is the thing of follow up. You have to write a follow up. Must write that. So that it keeps and tell the patient as well, verbally. So that it is in their mind that they have to come to you after 2, 3 days. Otherwise, they will rush. If they are not benefited, they will rush to the quacks. Okay? SB, please mute yourself. SB, SB, please mute yourself. SB. Okay, thank you. So, in the last, you see your signature. Harish will tell you how to upload that your short signature in your profile of eSanjeevani and name and registration number and qualification, etc. So this will all, this is the standard template of eSanjeevani e-prescription, right? Now, I was telling you that I'll be giving you certain important informations. Oh God. Okay. Certain information about follow-up care in diabetes and hypertension. Now, as you all know, this is a nuisance. Every 3 or 4 people out of 10 are suffering either from diabetes or a blood pressure or both. You agree? I think you are seeing the cases in OPDs in your practice every day. So you need to understand we are treating the cases. That's very easy. No problem. When we are treating in person. But if we are doing it through teleconsultation, you need to understand your restrictions. Where, as per guideline, as per the telemedicine guidelines, right? Now, what are those? Medication should be initiated in person consultation only in a newly diagnosed case. Suppose a health and wellness from a health wellness center, the CHO calls you. Sir, this patient has all osmotic symptoms. Osmotic symptom, you understand. nocturia, excessive urine, excessive thirst, excessive hunger, weight loss. These are osmotic symptoms. Now, the patient had this, so CHO did a RBS, and RBS was 200. Now, definitely, CHO is very happy that she has screened a diabetic case, and she will definitely give you a call. And now, what will you do? You should not start treating the case. Get this point. You cannot. As per guideline, you cannot treat any NCD case for the newly diagnosed NCD case on teleconsultation. Remember this. You have to see the case in person first before prescribing medicine. So what you do with that case, which CHO called for, you give a list of investigations you want to see while the patient is coming to you for in-person consultation, right? Like what? HbA1c, a common test, fasting blood sugar, common test, okay? Then serum creatinine, lipid profile. These are common routine urine. So these are common tests you need. And you can advise the patient also that you come to me first with all those reports. And then I will examine you, confirm the diagnosis at your place, and then we'll start the treatment in person. Get this. Okay? So this is under guideline. You cannot start NCD treatment through teleconsultation. You have to see the patient. The first consultation should be in person before you start the treatment in NCD. Remember that. But all follow ups, you can do all follow ups through teleconsultation. eSanjeevani. No problem. But first time treatment should be done in person after thorough examination and total confirmation. Right? All follow ups you can do up to when? Up to 6 months. I told you earlier with the opening remarks. The first consultation is valid until 6 months. After 6 months, you have to again see the patient in person, and that is again mandatory. To see the case in person again after 6 months is mandatory again for teleconsultation. And then you can do subsequent follow ups irrespective for the next 6 months. Okay? Apart from this, what happens during this follow up? During this follow up, after first in consultation, you advise the drug, say metformin, 500 milligram BD, you advise to the patient. The patient went back, okay, and came to, sorry, sorry, I'm not well since yesterday. I had some signal. Okay, so you advise the medicine like metformin 500 milligram BD, and you ask the patient to go to the health wellness center after 10 days, after your first consultation, at in-person consultation at wherever you are sitting, CSC or DH or PSC, wherever. And then after 10 days, the patient will go to the health and wellness center, have an RBS done, and can call you back. The CHO can give a teleconsultation, do a teleconsultation. You can do all follow-ups. For the next 6 months, after first in-person consultation, you can do all subsequent follow-ups through teleconsultation, during which, remember, during these follow-up consultation, you can continue the medicine you have given if the medicine is effective and sugar or blood pressure is controlled. You can increase the dose, remember, through teleconsultation. You can decrease the dose if you feel that your the medicine given by you is uh, should be reduced. You can decrease the dose, or even you can add on a medicine from list B, add on medicine. So you can do these things during follow-up consultation. Remember this. You can do anything for the next 6 months after first in-person consultation. Okay? No confusion. I don't think there is any confusion. But first consultation has to be in-person consultation. Okay? And all subsequent follow-ups you can do through teleconsultation. Now, but in between 6 months, if there is any new symptom, any new complaints or any complication, you have to call the patient for in-person examination. If during 6 months you found during teleconsultation that the patient had developed a complication or developed a new symptom, or he has some complaints about the treatment or his disease, you call the patient for in-person for a thorough examination again, and then only you prescribe the medicine. Right? So this is all about uh, diabetes or hypertension, the NCD. These are the same thing which I mentioned earlier, right? So that was the basics, and especially NCD because number of cases of NCDs are increasing. Now I'll go into case scenarios. I'll put three before you, three case scenarios. But I expect you to respond to the questions. It is not a knowledge testing. It is just understanding the whole thing uh, I have told earlier during this training session. So it is all refreshing that thing. It is all related to those things, right? So be interactive. I don't see any reason not to interact because I think there are about 30 people, 30 doctors. So I expect some of you to come forward and must take part in case scenario discussion because then only everybody will understand things, right? So a 45-year male came to the health wellness center. The patient is a known case of diabetes type 2, right? He was seen in the PSC or CSC in person first time and then was advised when he came to join this system, the SWC system, eSanjeevani SWC system. So he was seen at the PSC in person for the first time and then was sent to Health and Wellness Center after a month as a follow-up case. So go, do a follow-up, go to the Health Wellness Center, have a blood test done, and then call me up for a follow-up. Then accordingly, I'll advise. That is the standard in-person consultation advice. The patient, under your direction, came to Health and Wellness Center, got his RBS done, which was 2 gram per deciliter. Something which we care that patient must go when you ask him to go to health wellness center, right? His random blood sugar is 240 milligram per deciliter. Of course, it's very high. Now, what you should do, what the MO should do, can the MO prescribe the follow-up drugs via teleconsultation? Can you prescribe follow-up drugs? I've just mentioned it. Can you prescribe? Anybody? Yes, no? Anybody,
Yes.
please.
Yes, sir.
Yes, I have just told you. You can prescribe any follow-up medication. You can increase the dose, you can decrease the dose, you can add on any medicine, sort of that. Right? And what type of this teleconsultation? This teleconsultation, which CHO is doing right now with this case from Health and Wellness Center, what type of consultation is it? There are two types I said. First consultation and the follow-up consultation. Which type of consultation is it?
Follow-up consultation from
Very
CHO,
good,
sir.
Dr. Nirmala.
Yes,
Really,
sir.
this is really nice. Thank you very much. This is the follow up consultation because the patient had an in person consultation at PSC or CSC, wherever you are sitting, and then you suggested him to go for a follow up to Health Wellness Center, and that's why the patient is there, right? Now, what are your tasks? I'll come to the answer. Now, you will do a audio video consultation. You consult with the CHO, should speak to the patient on a video call, right? You have the idea because you are doing the follow up consultation. Yes, you are absolutely right that you can prescribe DM follow up medication through teleconsultation. And the patient came for a follow up, so it is a follow up case. Dr. Nirmala was absolutely right. And you gave a prescription. Now I'll have a small discussion here. You diagnosed diabetes mellitus type 2 with high RBS, random blood sugar, right? That's true. Now you gave a prescription, hypothetically, continue tablet metformin BD, which the patient was taking earlier. Metformin 500 milligram BD he was taking earlier before he came for what you call the in-person consultation. So you prescribed during follow-up, which you prescribed in your in-person consultation, metformin 500 milligram BD, but RBS got high. But you continued metformin 500 milligram BD with lifestyle modification of diet control, increasing physical activity, sort of, and then you advised HbA1c. Now tell me the rationale of this. Why did you not increase the dose when RBS was high? Can someone tell me? Normally, a doctor increases the dose the moment RBS is high. Normally. But in this hypothetical case, you have not increased the dose of the metformin, you continued it with lifestyle modification things, diet and physical activity increase, and HbA1c. Why? Why so? You could have easily increased the dose to treat the case. Anybody?
Uh, Sir,
Uh,
RBS is that day's metabolism, sir. But HbA1c is a 3 months thing.
Right.
So
Absolutely.
the if the HbA1c was within 6 to 7 within control, sir, then might be that is the reason why the doctor has not suddenly increased the anti-hypoglycemic agent, sir.
Right. Absolutely right, Dr. Newman. Now the doctor treating this case did not increase the dose of metformin only because RBS is a transient increase of blood sugar. Maybe the patient had a heavy diet with sweets in the morning. His RBS will be high today. Maybe for the last 2 days he was attending some marriage parties and all. This is the marriage season. So his RBS will be high today. Maybe he forgot to take his regular medicine of metformin. So his RBS will be high today. But it may be transient. So we have to confirm whether it is a prolonged increase of the blood sugar, average blood sugar. And that's why doctor continued the medicine. If it is transient, he restricted the diet, increased the physical activity, and if it is transient only because of those reasons which I mentioned, then the sugar will come to the normal automatically with the same dose of medication. Right? That's why he continued the medicine and asked for HbA1c because SBA, Dr. Nirmala mentioned, it's an average blood sugar for the last 2 to 3 months. So that's a big time period. If all through his average blood sugar is high, it means we need to increase the dose. It is a simple logic, simple analysis. We have to consider it that way. Right? Anything here? No. Okay, the same male, the same patient got his SBA1C done, and now it is 7.8%. Is it high? Yes, it is high because 4.5 to 5.5, 5.6, 5.7 to 6.5, 6.6 onwards. This is the standard normal, pre-diabetic and diabetic range. Is 7.8. It's quite high than normal of 6.5, after which we think that a patient is diabetic. So it is 7.8. Now what you should do? Can you adjust the dose of metformin through teleconsultation? Yes, you can. I told you earlier. You can continue the medicine, you can increase the dose, you can decrease the dose, you can add on any medicine. Please remember, through teleconsultation, eSanjeevani. Okay? What type of titration can be done by the hub doctor via teleconsultation? And what are the typical key tasks for PSCMOs? I'll tell you the answer because time is short and you people are very busy. So I'll just go on telling it. You again, with with the patient, you have a audio video consultation, right? You can do that. You can titrate the doses of metformin. Yes, you can do, right? And what you did was you met the diagnosis where I said diagnosis is very important in each case. You must make a diagnosis before giving prescription. So in this case, it was diabetes mellitus type 2 with high HbA1c. And what did the doctor do? Increase the dose of metformin. That's the diabetic treatment guideline. Under diabetic treatment guideline, there is a guideline. You must go through it. First, you increase the dose of the medicine you are giving. First once, then BD. Right? So he increased the dose to 1000 milligram BD. And with all the same lifestyle modification, increase physical activity, and follow up after a month. In this, it is mentioned that he called the patient after a month. But my idea, my advice, my experience says when we increase the dose of the medicine, there are all chances that patient may pass into hypoglycemia. So we need to be careful and we must explain about hypoglycemia or hypertension in hypertensive cases, the effect of the sign symptoms of hypoglycemia or hypertension, so that patient is aware once he increase the dose of the medicine. He may have bouts of hypoglycemia. In that case, what they have to do? What should they do? Right? So these things are essential, and that is the counseling part, if you say so. Whatever treatment we give, we should explain to the patient that, okay, look, the moment you feel a little dizzy, little weak, tremors in your body, sweating in your heart racing, and tongue drying, you feel what you call thirst, just sit where you are, have some sugar. So you can advise that way, right? So that he does not pass into severe hypoglycemia. That's the worst cases I have seen during my practices. Worst cases. And some cases died because of diabetic hypoglycemic coma. They could not come out of coma despite of the heroic activities. One or two cases in my 44-year career. Okay, so it was in the hospitals, by the way. Okay, so this was it, and I will just go one more, I think, and that's that. Uh, 18. Nice. Now, a 24-year female brought by her mother, okay, brought by her mother to you. through teleconsultation, with episodes of panic attack, fear, and frightening, since 4 hours duration. Okay. She developed similar kind of 2, 3 episode in the last 2 months. So frequent. The MO means you took informed consent from the patient and her mother for teleconsultation, which I mentioned in the opening notes. Consent is mandatory and legal. You must take. And it's the duty of the CHO. So you must ask the moment you are connected with the CHO, must ask, have you taken the consent? And show me where. Right? So you took the consent, the CHO has taken the consent, now you are doing it. The PSCMO made her calm down and connects to a psychiatrist at DH, Telemedicine Hub, after uploading the entire. Now this is doctor to doctor. You got the call, now you are calling a psychiatrist. Why? Because this is a psychiatric case. And I told you, list A additional drugs, which are antipsychotropics, should not be prescribed by you. So you need to consult a psychiatrist to get his prescription for this patient. Right? So this is very simple. That's why I wanted to show you as an example. Okay? You should not. Okay? Now, uh, 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 okay. There is one case. The 4-year female child brought to CHO at Health Wellness Center by her father with continuous seizures for the last 5 to 6 minutes. No history of fever, head injury, or consumption of any harmful substance. There was no history of these things. On examination, convulsation was there, continuous, unconscious, up rolling of eyeballs. The eyeballs turned up. Okay? Now CHO calls you and you see the case this way. What will you do? What should you do? Is the teleconsultation required in this case? With hub doctor. Hub doctor means a specialist. Why? What is the best treatment plan for the child? Okay? You may have some doubts about it. So I'll show you the answer so that it is in your mind. Okay. The PSC MO should quickly review and assess the airway, breathing, and pulse by checking with CHO. That these are three vital things you need to check. What? Airway, breathing, and pulse. Okay? Then ensure the CHO to call to 108 and make arrangement for emergency referral. Immediate. These are the steps you should know about in case of that emergency. Ask the CHO to keep the child in left lateral position and to prevent from injuries or regurgitation. Left lateral, sideways. Left lateral is the standard position, right? Ask the CHO to test RBS using glucometer. अभी मैं मीटिंग में हूँ। नहीं नहीं वो हम दिखाते हैं उस दिन। हाँ हाँ ओके ओके ask the CHO. Now why RBS? In acute convulsion, sugar goes down. The patient passes into hypoglycemia gradually. So we need to give glucose. This is, you all know about it. I think you all know about it. So must test blood glucose before uh, shifting the patient to the for IPD treatment. To start supplemental oxygen using face mask, you must give oxygen to that baby. Speak to the patient's father and counsel on the condition and immediate referral to a higher facility. These are very important steps in this case of this type of emergency cases. Guide the CHO to give rectal diazepam 4 milligram or midazolam nasal spray. These are acute thing which needs to be given in case of that. Continuous monitoring, early referral, counseling of attendance, which you did, inform referral center about the patient beforehand to provide referral slip to the father. So you can give a prescription, refer to district hospital or medical college hospital, wherever you feel that you should send the case. Right? So that is it. That is what this type of case, this was a case of typical epileptic seizure. And these are the steps where you should do the treatment in a stepwise. And you see, we have kept it, you have kept it yourself to the first aid and life-saving measures, right? This is all first aid. Review for airway, breathing, and pulse. Ask to keep the child in left lateral position to avoid any regurgitation. We all do that. So these are the first aid, life-saving measures. Check the RBS and give IV dextrose if they have, if CHO have. So there are 106 types of medicines, essential drugs, which should be available at health and wellness center. And majority of the common drugs out of that 106 are available. So you can have that list with from the CHO, what drugs are available to them, so that it will be easier for you all to prescribe them and to help the patient who are really needy people. First of all, uh, we must be a little human about treating those rural community. I know we work extra hard or extra to help them through teleconsultation, eSanjeevani, doing eSanjeevani consultation. It is a little uh, tough on you while you are doing all other types of your day-to-day work. You are very busy. But on a human ground, we must do something for that rural population. And we need to remember, we all have come from that root. Our forefathers, four, five, six generations of before, they all were the part of that rural community. We may have uh, we got educated, we migrated from those rural places. But five, six generations back, our forefathers were the rural population, was among the rural population, and they had the same issues at that point of time. So we need to be human, and we should pay our homage to our forefathers who have lived there earlier, and due to whom we are in this world, we exist. So we should pay back to that community from where our forefathers have come. So that is all I want to tell you. So thank you. Yeah. But the teleconsultation, yes, I just forgot to add this thing. But the teleconsultation scope is limited for emergency conditions that I told you earlier. There is a delay in getting teleconsultation advice from the doctor, and most should inform the CHO to refer the child immediately. This is the emergency case, and aim is to stabilize the patient with the guidance from quick teleconsultation. Quick teleconsultation that should not take much time. The best treatment plan is first aid followed by stabilization of patient with or without the teleconsultation guidance, with emergency referral and transport to FRU. Okay, so this is complete answer to that case scenario. I just forgot before finishing. So, so thank you all very much for a patient hearing. You have been a good listener, I think, and I don't know if you have any question. uh, First time I'm seeing that you people are not dropping out so fast. Last time I was doing it started with a bang with about 35 people and it came to three people when I ended with. So I was very, what do you call, uh, I was sad about it that learning is an ongoing process. You can learn from me. I don't know how many things I could explain to you which you did not know. But yes, I agree. I have told you very basic things to do the teleconsultation. So please and please do the teleconsultation for the sake of that rural community who do not have much money to get the treatment of a doctor, and they do not have much money to buy costly medicine, to get costly investigations done. So all you need to help them as much as you can. Thank you all. Thank you very much. Thank you. Thank you, Harish. That's enough for the day. Okay?
Thank thank you, sir.
Okay.
Sir, if you have any doubts, you can ask, sir.
Yeah, you can ask any question. Yeah, anybody have some question, please? Any doubts explaining you? I've kept it to the basics, to understand the basics of eSanjeevani. Okay. So with a hope that you will do it, and you will do it with all keeping in mind the guidelines, the emergency situations, the non-emergency situations, the guidelines of diabetes and NCD guidelines, what you saw, NCD treatment guidelines. So you should learn those things through your own books or your own way, and follow that thing. It is like another OPD you are doing, other than what you are doing presently in your institution, CSC, PSC, wherever you are doing. So it's another OPD for, say, 1 hour, 1.5 hour every day. If you give, that will be a boon for everybody. So, any question, please, if you want to. No. Tell me that you don't want any answer. Tell someone. If you are hearing me, if you are hearing me, tell me. No.